Hi, my name is Susan Elliott, and I am a nurse practitioner at St. Louis University School of Medicine. I work in the Division of Geriatrics. The presentation today is on meaningful activities in the post-acute long-term care setting. So first, a disclosure, the project is supported by the HRSA grant, GWEP grant, so for Geriatrics Workforce Enhancement Program, which was awarded to our university, and part of my salary is definitely supplemented by this. The objectives today: what makes an activity meaningful and to whom, correlating the meaningful activities with the 4 M's, which is a conceptual model you see here listed on the right slide, what matters, so patient-centric, medication, specifically polypharmacy, mentation, depression, delirium, dementia, and mobility. So these are the things that we keep in mind so that we're establishing an age-friendly health system. We'll discuss post-pandemic strategies to promote health and well-being through activity, and then the evidence in each slide is listed and referenced at the end. So what is not meaningful? Television. So in a large study in 2015, residents were mostly observed sleeping, having no activity, or having television on up to 77% of the time. To be meaningful, it should be enjoyable, engaging, improve emotions, thinking, and functional ability, and decrease behaviors in people with dementia. So you can see the classifications of meaningful activities here. A brief social stimulus could be something like meeting with a friend or family or even staff. Computer-assisted activities could include reading in an online library, using an artistic app. Task-oriented could be something as simple as a dementia patient folding towels to be purposeful, or it could be something like someone tending to a garden. Food-oriented activities, very important in the nursing home. They provide us both with invoking the senses and then also providing opportunities for nutrition, and they make people happy. Cognitive stimulus could be something like putting together a puzzle or participating in a formal therapy. Exercise, getting people moving, most important. We'll see that in the evidence as we talk. And then music, including dancing, very important, specifically when it's individualized music, and we'll see that come out. Spiritual, yes, we have nursing home church services, very important in feeling connected. So think about the 4 M's with these different classifications. What matters? I would argue all of these are what matters to people. Think about mentation. Some of these specifically address mentation more than others, but I believe all of them would improve mentation. But say cognitive stimulus. And then exercise, that would be your mobility. We'll find that exercise also reduces medication use in the evidence. So happy to move forward with this, and let's see what we can find. So why do we perform the activities? The newer evidence in 2017 shows that participating in personally treasured activities promotes a sense of belonging, recognition, spiritual closeness, connectedness, and provides meaning and purpose to life. Individualized activities promote meaningful participation, enjoyment, and instill dignity. So the social component is very important. The new evidence from 2017 to 2021 shows that meeting someone liked facilitates thriving, relationship building with staff, family, and friends, and an activity involvement invoke a sense of home, and this is a home for these people. Social activities the week prior lessen depression, and that's huge. So in 2022, a large systematic review was looking at well-being and affect in residents and nursing homes, found that the highest level of evidence supports using individualized music, music therapy, and dance to improve mood, anxiety, and engagement. Also use the highest level of evidence to support a recommendation for tailored or structured life review with narration or storytelling to improve well-being and mood. And then the next level evidence was used to support tailored or individual activities to improve engagement, affect, quality of life, thriving, alertness, and verbalization. So again, back to the 4 M's. Doll therapy was examined in people with dementia. So previous studies had some mixed outcomes with using doll therapy. It was thought to be patronizing at some point. But actually, doll therapy improved connections with the external environment, promoted bonding and attachment, promoted greater well-being and happiness, improved social behavior, and decreased negative behaviors, including aggression, and improved sensory stimulation and communication. So in 2016, another systematic review and meta-analysis was used and used grade B evidence to recommend individualized recreational activities for people with dementia living in a facility to help treat various behaviors and psychosocial symptoms of dementia. So specifically, music therapy was recommended for agitation, anxiety, and depression. So wandering in people with dementia. A study in 2013 looked at activity in conjunction with wandering and found that less activities were associated with increased risk of non-modifiable wandering. And non-modifiable wandering, meaning it cannot be redirected, is associated with increased care resistance and increased antipsychotic use. So the implication here is that increased activities could decrease the wandering and the antipsychotic use in the nursing home. So groups of health providers were put together in focus groups to evaluate meaningful activities for people with dementia transitioning to the nursing home. And the three themes that were identified: attention awareness, personalized meaningful activities, personalized being key, and then organizational care. So the bottom line is multidisciplinary collaboration with single team approach focused on individual needs. Family involvement and having a conducive environment is what was important to facilitating meaningful activities. Later, the same authors came back and did another review in 2021 and found that the activities had to be continually adjusted in people with dementia to remain meaningful. When looking at physical activity and mild cognitive impairment in 2020, it was identified that mind-body activities and mixed physical activities both had a small effect on global cognition. Resistance training, however, had a large effect on global cognition. So very low certainty, but it did have a large effect. In looking at physical activity in people with dementia, authors noted that you had to have brain stimulation, physical involvement, or both. So physicality was most beneficial in advanced dementia, and physicality and mental stimulation was most beneficial in mild to moderate dementia. So looking at the physical activity on global cognition in people with dementia, physical activity improved global cognition in Alzheimer's disease and all dementias, as you can see here. Communal dining is a meaningful activity. Dining areas with socialization and increased choices result in increased nutrient intake, reduced food intake barriers, but are less effective on dementia units where people require individual needs to be met. So on this slide, you'll see the timeline at the top of the COVID lockdowns on the nursing homes. It started in March of 2020. We started reopening by May, but there were months that went by that people were completely confined to their rooms. So no visitors, no adjunct staff, not even hospice could come into the nursing home. And staff that were in the building limited their time in the room. So people are under strict room confinement. Communal dining was halted. Group activities were prohibited. The whole activities department was reduced to what you see here in the basket, a group of individualized interest items. So even with reopening and the return of the group activities, albeit 6 foot apart and limited amount of people in the groups, a crucial aspect was missing, and that was having loved ones back in the facility. So there was a study in 2022 that looked at the interventions that happened during this time and identified staff advocates being assigned to each resident really did help with bridging that gap. So family support groups were quite helpful as well. I'm happy to say that both of these things did happen in the nursing homes that I worked in, but it did mitigate poor outcomes. And yes, we still have the family support groups as we speak. So in looking back at the lockdown, a large U.S. retrospective study of 15,000 skilled nursing facilities with 3 million resident years from 2018 to 2020, which looked at the lockdown comparison to the previous year, identified weight loss. Now, this is no surprise, but if you look, the non-COVID people also had weight loss. There was worsened depression, and these were both statistically significant. So Spain did the same thing and looked back on everything and found that functional, cognitive, affective analysis before and after the pandemic lockdowns showed lower cognition, lower function, and higher depression. So it wasn't until January of 2022, when staff vaccine mandates were put into place, that things really started to get back to normal, because family came back and what matters was restored. So having those brief social stimuluses, being able to participate in what made someone happy, made their life worth living, happened again. So that's where we're at now, and these are the lessons that we've learned. I'm happy to be able to share this information with you and hope you found it interesting. So you can see here are my references. And if you had any questions, you could get a hold of our department. We'd be happy to answer. Thank you. Bye-bye.